although scoliosis in adults may not be able to be completely fixed, it doesn't mean it cannot be improved. This is what I mean by that. Well, when we think of scoliosis, we have to first understand what scoliosis is. Scoliosis is actually a three-dimensional spine deformity. What I mean by that, with scoliosis, the bones have actually changed shape over time. Whether that's a scoliosis that's developing during adolescence or childhood, or if it's a degenerative scoliosis in adults. And the one thing we cannot change is we cannot change or reverse the actual bone deformity or how the bones have changed shape over time when someone is an adult. But there's another component to scoliosis in adults, and that is a postural collapse, meaning the body can actually collapse with postural changes, or there could be big changes in how we view the spine in overall or global alignment from the front or the side, and that's what we call balance. And the postural collapse or the balance frequently can be improved or reduced when we're treating adults. Hi, I'm Dr. Chris Gubbels. I'm a leading authority in the non-surgical treatment of scoliosis and hyperkyphosis. And in this video, I'm going to help you better understand what can and cannot be done to help improve or treat adults with scoliosis. Now, if you're watching this video and you have scoliosis and you're really looking for some immediate answers, one thing I'm going to encourage you to do is click on the link below and actually request a free discovery call, and that'll give you a chance to set up a time to talk to me one-on-one about your scoliosis, how severe it is, and what can or cannot be done. So when we're thinking about adult scoliosis, and if someone asks, can it be fixed, we have to really understand what someone means by the term, can it be fixed? Now, if someone has a scoliosis as an adult, can we completely straighten the spine? That we know we cannot do. That does not mean that the spine cannot actually be improved. Let me give you an example of what I'm talking about. So this is an example of a young adult, and she presented to the ScoliCare clinic when she had a 44-degree scoliosis. And you can see in the picture she also has a big postural shift and collapse in her spine. This patient was actually denied joining a high-level ballet in New York because her body was disfigured, and she had this big misaligned appearance or disfigurement just looking at her physical appearance from the outside. So she was fitted with a custom 3D scoliosis brace that actually put her in an opposite or overcorrected position. And you can see in the photo, the picture of her x-ray before, you can see her body shifted over. You can see her in the brace that's holding her in an opposite position. And then you can just see the appearance of her body afterwards and how much of an improvement she has in the physical appearance, posture, and then you can actually see her x-ray where her curve reduced from 44 to 29 degrees. So in this case, we did reduce the overall Cobb angle of the scoliosis, and she still has a 29-degree curve. What we did not change is the actual structural changes or the bony deformity. We improved the coronal balance or the misbalance where the body was shifted to the side, and we actually reduced the actual postural collapse. So when we think about reducing the overall curve size in adults, it's typically in younger adults that are more flexible before the spine has got stiff or more rigid, which frequently happens in later adulthood with adults with degenerative scoliosis. So this is a perfect example of what can and cannot be done for an adult with scoliosis. So when we think about scoliosis in adults, there's more than one type of cause. First of all, you could have someone that developed scoliosis when they were younger. They had an idiopathic scoliosis that they still have as an adult, and frequently that scoliosis they have when they were younger progresses and gets more severe and turns into a degenerative scoliosis. Or you could have someone that actually develops a new scoliosis as an adult, which is called a degenerative de novo scoliosis. And then there are some people as an adult that have a scoliosis that may be secondary to some other health condition due to neurodegenerative conditions like Parkinson's disease or Alzheimer's. It could be secondary to trauma or post-surgery, or possibly secondary to like an anatomical leg length. So we have different types of scoliosis in adults, but overall these scoliosis tend to become a degenerative condition. And what typically happens is you have an asymmetrical alignment. For example, if you had a scoliosis when you were younger, you already have an asymmetrical misalignment, and that puts asymmetrical pressure on the joints. You're going to have more pressure on one side of the disc compared to the other side, or you're going to have more pressure on one facet compared to the other side. You could also have an abnormal alignment from the side where you may have a loss of the normal curves of the spine from the side, and that creates some instability in the spine. Basically, you have asymmetrical alignment that causes asymmetrical pressure on the joints, and that leads to asymmetrical degeneration. When this happens, part of the joint will break down on one side faster than the other side. This typically develops in the disc and the facet joints. And as a facet joint and a disc on one side break down and decay, you get more asymmetrical misalignment, you get more asymmetrical pressure on the joints, and then you get more asymmetrical degeneration. And this process just perpetuates and gets more and more, and the spine tends to progress. Now, as the spine gets more degeneration and more misalignment, the spine starts to get stiffer. And the stiffer the spine gets, the harder it is to reduce the postural collapse or the postural imbalance. So now that you understand what causes scoliosis, we have to probably more importantly look at what's the overall goal of treatment in adults. The number one driver of treatment in adults is actually pain and loss of function. So when we think about adults, the primary goals are to reduce or eliminate pain, stop or dramatically slow the progression of degenerative scoliosis, improve function, which means help people do the normal things they want to be able to do in their daily activities, and then possibly have some improvements in the overall physical or aesthetic appearance someone may have. When we look at overall alignment, a couple of things we really want to try and change is if someone has a big coronal or sagittal imbalance. A coronal imbalance is when your body is shifted from the side. So normally, the upper part of your thoracic spine or the lower part of your cervical spine should be lined up straight over the center of your pelvis. And if that gets shifted to the side, we call that an unbalanced spine. We can actually measure that with something called the central sacral vertical line. And the larger that imbalance gets, the more likely you already had pain from the scoliosis, the more likely it is to continue to progress, and the more likely it is to impact your overall function and just ability to do normal daily activities. And typically, if that misalignment gets more than about 4 centimeters, that's a high predictor of pain and disability. The same thing is we evaluate the same kind of alignment when we view the spine from the side. This is called sagittal vertical alignment. And when you get an anterior translation of your upper thoracic spine or lower cervical spine more than 4 centimeters forward compared to your sacrum, that's called a large anterior or positive anterior sagittal balance. And also when that gets beyond about 4 centimeters, that's a huge predictor for pain and instability. Now, these coronal and sagittal imbalances are also the number one predictor of pain and disability in adults for chronic low back pain. They can also impact things like loss of balance and increased risk of falls or fractures. So when we're looking at treating adults, one of the things we want to try to improve to help reduce pain and improve function is overall spinal balance, reducing coronal imbalances or sagittal imbalances. And what's interesting about that, I talked about initially, the number one driver of treatment is actually pain reduction. And one surgeon, a colleague that I respect, told me, we don't actually believe it's the actual deformity that's actually what causes pain. It's the compensation of the deformity that causes pain. That coronal or sagittal imbalance is the pain driver. And when we look at adults with scoliosis or hyperkyphosis, these are called adult spine deformities. Basically, their body is collapsing under the weight of gravity. And if you look at someone from the side, what typically happens is, first of all, they start to lean or tilt forward with that scoliosis. When you get scoliosis, your body is going to start to shift to one side, and you're going to compensate by starting to lean forward. Then what happens is your pelvis will actually tilt backwards. Then the patient will bend their knees to adapt to that. Then they get this large anterior lean forward and their head goes forward. And it's that adaptation that drives pain. So if with treatments we can improve the overall adaptation to the deformity and improve overall spinal balance, that also will help us achieve the primary goal of reducing pain and improving function in the patients. Now, what treatments are effective in improving adults with degenerative scoliosis? Well, first of all, things like general chiropractic, general physical therapy, massage, PT, yoga, trigger point injections, pain medications, radiofrequency ablation, joint injections. Those things may be good to help reduce pain and improve mobility, things like that. They may have a lot of other health benefits, but those treatments on their own can do nothing to keep a curve from getting worse or potentially improve the curve. There are 3 treatments that have really been shown effective at treating these adult spine deformities or adult scoliosis. One of those is surgery. All right, surgery is a treatment that's typically used in adult degenerative scoliosis, but the goals of surgery are the same goals of non-surgical treatment for scoliosis. So we should only do surgery when the most effective conservative treatments have failed or been unsuccessful. So one potential treatment option is surgery, but something else to consider: as we get older, the risk of complications with surgery also grows up. So what other treatments do we have? One, we have scoliosis-specific exercise. And this is different than traditional physical therapy for scoliosis, because what we do is scoliosis-specific exercise or rehabilitation is we actually teach the patient how to put their body in a true three-dimensional correct position. And then we work to strengthen and stabilize the patient in that three-dimensional correct position. And then we actually work and teach the patient how do we hold or put our body in a correct position while we do our normal daily activities, the things we already do in our everyday life. Now, there's various methods of scoliosis-specific exercise. One of those is Schroth. There's one that's called C's. There's one that's called side shift method. But a newer method that we use in ScoliCare is called ScoliBalance. And ScoliBalance actually works to balance your spine in adults. And ScoliBalance comes from many different methods. We combine things like from Schroth and C's and chiropractic biophysics. We combine things from these various methods, and we apply whatever's the most important and the most effective for each and every patient. And one of the problems with some of these methods, like Schroth, is they can get very complicated and hard for the patients to do at home and on their own. And so with ScoliBalance, we work to make the treatments easier and more effective for both the provider and the patient. And we work to make sure it's easier for the patient to incorporate these at home in their daily life, because that's going to make the treatments more successful and sustainable long term. So one of the treatment methods is scoliosis-specific exercise. Another method is custom bracing. Custom bracing can be effective in reducing pain, stopping and slowing progression, and in some cases reducing the size of the curve, and in many cases improving the coronal or sagittal balance in patients. Now, not all braces are the same, and a lot of bracing companies try to treat adult scoliosis the same as adolescent scoliosis, and they're completely different. For a brace to be effective, it has to be truly three-dimensional and truly customized for each and every patient. At ScoliCare, we have many different ways we can design braces for adults depending on their goals, where their scoliosis is, and a bunch of other things we have to consider when making that brace. And now, because scoliosis is so prevalent in adults, we probably do more bracing for adults than we do adolescents, because there's a lot more scoliosis in adults compared to adolescents. And now what's interesting is I meet with surgeons all the time. And when I talk to surgeons that treat adults, many of them have never really heard or have heard very little about treating patients with braces, and possibly very little about treating patients with scoliosis-specific exercise. But also, the better surgeons don't want to do surgery unless they have to, unless all other treatment options have failed. So we actually get a lot of patients at ScoliCare that get referred to our office from surgeons that treat adults, because they know they can do surgery as a last resort, but they want to try the non-surgical treatment options first. So if you're watching this and you want to learn more about scoliosis in adults, one, be sure to click on our link below and download our free ebook on adult scoliosis called Scoliosis Knows No Age Limit. And if you have scoliosis and you're trying to find treatments, or you're trying to figure out what works or what doesn't, click on that link below. Request a free discovery call. That'll give you a chance to talk to me one-on-one about your scoliosis. I'm going to let you know the severity of it, how likely it is to progress if you don't do anything, and most importantly, what treatment options may be available to you. Now, to learn more about the most effective treatment options for adults, be sure to click on our next video, and I'll see you there.